I'm Dr. J. Akaf. I'm a certified periodontist. I also specialize in dental implants. Today we're going to talk about sinus grafting and why we do sinus grafting if we were to do dental implants on the posterior area of the upper jaw. Now I'm going to show it to you on these models and the procedure and also why we do them. Now here is an actual implant. You see? Now, if I were to measure the length of this implant, it's about 10 millimeter or so. They come in different lengths, but we usually like to go for 8 to 10 or 12 millimeters. Now, if I were to place this implant on this jaw area here, then if the jaw area from the ridge to the floor of the sinus is about 5 millimeter, it will go right through, you see? Now, just to get an orientation here, this is the nose, this is the sinus area, right and left. So if I were to place that implant again from the ridge to the floor of the sinus, it will pass right through, and that implant will not be within the bone. So what we would do, on one procedure, we could come to the side of the jaw, take a little bit of bone out, push the membrane in. There's a membrane called Schneiderian membrane. This membrane, it's really thin, it's onion skin thick. We push that in, and then we place the implant, and then we pack this area with bone, and this area is going to be covered with the membrane here. And what it happens is that this will regenerate. Now we have all of our implant within the bone. And after 5-6 months, what we would do, we will put this abutment over this implant, and then we will put this crown over it. Now, the other method of doing this is that we will go in there. We don't go to the side of the jaw. We will put a hole right through to the floor of the sinus, and then we push that up with certain type of instrument, specialized instrument, and push the membrane up, and then I create the same amount of space in there to have implant within the bone. That's called the crestal approach to do this procedure. Now, I could show it to you on this model too, which is a better one. You see, it shows it a little bit bigger so you could see it better. You see how we removed a lot more bone than we normally do, so you could see the implant within the sinus, and it shows the sac that we created. Now, if I were to show it to you on an actual patient, you see this patient came in, had this cantilever bridge because there is not enough bone here before it reached the floor of the sinus to place the implant. So what we did, we cut this back portion of the cantilever bridge, which was putting a lot of pressure on these two teeth, by the way, and it will make them fail. So what we did, we put bone inside the sinus here through the crestal approach. So we put a hole here, and we reached this area here. You see, and we packed bone through that opening. You see, this bone right there. And then I was able to place these two implants all within the bone. Now, after 5-6 months, we can get in there and put crowns on these two teeth. And the patients will have two separate teeth here that he can clean in between easily. Now, my name again is Dr. J. Akaf. If you like to reach me, I am at SanDiegoDentalImplants.com. If you have any questions, I'll be happy to answer those for you. And thanks for watching.